at Barangay Bumboneg, San Gabriel, La Union, to have a further study about the alarming issue on this community, which is dengue.
Dengue. Dengue is a disease caused by any one of 4 closely related dengue viruses. The viruses are transmitted to humans by the bite of an infected mosquito. In the Western Hemisphere, the Aedes aegypti mosquito is the most important transmitter or vector of dengue viruses. It is estimated that there are over 100 million cases of dengue worldwide each year.
Mosquitoes usually live around areas that have still waters, like ponds and on aquatic plants. They also live in those that are filled with water by people, like drums, plants in water, potted plants, and vases. They also live in those that are filled with rainwater, like discarded tire, bottles, pots, and ponds, broken appliances, and items left outside such as garbage cans.
One of the victims of dengue is Mrs. Nieves Velasco. Apong, kasano kayo nga nagka-dengue? Ri na yun di nagka-dengue kayo?
Aguli-gula, agbara sa bagik, magsakit sa ulo. Sumala, minsan aglamin. Subis pati, hindi, alam, aguli-gul ka, agbara ka, bagik. Ito no, malapas si barang, aglamin ka. Sumala.
The principal symptoms of dengue fever are high fever, severe headache, severe pain behind the eyes, joint pain, muscle and bone pain, rashes, and mild bleeding. Example of these are nose or gums bleed, easy bruising. Generally, younger children and those with their first dengue infection have a milder illness than older children and adults.
Have a fever, headache, and body aches, you need to drink plenty of water and take paracetamol every 4 to 6 hours. If you don't feel better in 3 days, please see a doctor.
There is no vaccine for preventing dengue. The best preventive measure for residents living in areas infested with Aedes aegypti is to eliminate the places where the mosquito lays her eggs. Primarily, artificial containers that hold water, items that collect rainwater or to store water, for example, plastic containers, 55-gallon drums, buckets, or used automobile tires, should be covered, or properly discarded pet and animal watering containers and vases with fresh flowers should be emptied and cleaned to remove eggs at least once a week. This will eliminate the mosquito eggs and larvae and reduce the number of mosquitoes present in these areas.
Using air conditioning or window and door screens reduces the risks of mosquitoes coming indoors. Proper application of mosquito repellents containing 20% to 30% DEET as the active ingredient on exposed skin in clothing decreases the risk of being bitten by mosquitoes. There is increased risk if an epidemic is in progress or visitors are in housing without air conditioning or screened windows and doors. To prevent dengue, the people in Barangay Bumbuneg works hand in hand to eliminate mosquito dengue so that the people in their barangay stay healthy. Parents will not worry about their children playing outside their homes. Grandparents will not be afraid to walk around their barangay.
By fighting dengue as one, we can stop its dangers at once. Our lives, our fight.